Hello, cat and feline medicine lovers. Welcome to our Feline Perfect podcast. Here you will find news and essential information for the well-being of cats. Grab your headphones and relax for another episode.
Hello everyone, welcome to another episode of our podcast. Today, we're diving into a crucial topic for us veterinarians, acute pain analgesia in our beloved cats. After all, who isn't moved by a feline suffering? Our mission is to ensure they receive the best possible relief. To guide us on this journey, we'll rely on the 2022 guidelines from ISFM, the International Society of Feline Medicine. Think of these guidelines as a treasure map, a comprehensive and up-to-date guide for pain management. And remember, it's not just about giving medication. It's about creating a complete plan that embraces the emotional needs of our furry friends with lots of care, avoiding stress, vomiting, and anxiety. Before we talk about treatment options, how about understanding a little more about how cats process medications? Imagine their bodies as small factories that sometimes work differently than we are used to. Some drugs, like ketoprofen and morphine, take longer to be eliminated, while others, like meloxicam and buprenorphine, are processed much faster. And we can't forget about comorbidities, such as chronic kidney disease, which affects many older cats. In these cases, it's as if the factory has some worn-out parts, and we need to adjust the doses and intervals of medications very carefully. Gabapentin, for example, can have its effects enhanced in cats with CKD, requiring a lower dose. Now, let's get to the good stuff, the analgesic plan. Remember, each cat is unique, like a fingerprint. We need to individualize the approach, considering the type of pain, frequency, and duration. Think of preventive analgesia as a protective shield, administering analgesics even before the painful stimulus. We can use anti-inflammatories at the end of the procedure or an opioid in the immediate postoperative period. Multimodal analgesia is like an orchestra, where different analgesics play together in harmony, each with its mechanism of action. This allows us to use lower doses of each class, preventing adverse effects. And it's not limited to drugs. We can include non-pharmacological therapies, such as massages and acupuncture. What are the main classes of analgesics we should keep in mind? Local anesthetics are like a roadblock on the pain highway, preventing it from reaching the brain. ISFM presents us with techniques such as dental blocks, which are easy to perform and provide early postoperative relief. Opioids are our allies for more intense pain. Methadone is a great option when NSAIDs are contraindicated, while buprenorphine is useful for mild to moderate pain. Non-steroidal anti-inflammatory drugs, NSAIDs, are like firefighters combating inflammation. Meloxicam and robenacoxib are modern options that can be administered for more than one day with proven safety and efficacy. And we can't forget about adjuvant analgesics, which complement the multimodal plan. Dexmedetomidine promotes sedation and muscle relaxation. Ketamine can prevent central sensitization. Tramadol can be useful in some cases, and gabapentin reduces anxiety. To choose the ideal protocol, we can use the TALS concept, which considers the type, duration, location, and severity of pain, as well as whether the patient is outpatient or inpatient. In addition to drugs, some points are crucial to improve the patient experience: managing anxiety and stress, controlling nausea and vomiting, providing adequate nursing care, using non-pharmacological therapies, creating a calm environment, and ensuring the palatability of medications. And the future of feline analgesia is promising. We are advancing in understanding feline behavior and developing pain assessment tools based on artificial intelligence. The approval of new drugs such as transdermal buprenorphine also expands our treatment options. Remember, the success of the analgesic plan depends on the continuous assessment of pain. Use tools like the Feline Grimace Scale to monitor patient comfort and adjust treatment as needed. In summary, acute pain analgesia in cats requires a multimodal, individualized, and evidence-based approach. By combining appropriate drugs with supportive care and attention to the patient's emotional well-being, we can ensure pain relief and a faster, more comfortable recovery. Thank you so much for joining us on this episode. I hope the information shared is helpful in your daily practice. See you next time.